Hey, what's up, everybody? It's Kenny Lamons here with Medicare Millennials. We're taking you guys on our journey to building a large, successful Medicare book of business. And we do train and recruit agents to sell Medicare plans year round. And you'll often hear me say this. There's many different ways to sell Medicare plans. There are different types of Medicare plans. Some make more sense to sell than others, depending on your situation. And I never try to overstep my bounds and claim to be, the greatest Medicare salesperson in history, but we do have a really great way that's been effective for us, and I believe is one of the best ways for an agent to break out into the Medicare space. With that being said, one of the most rapid changes recently for newer independent insurance agents is kind of the ability and the evolution of selling Medicare Advantage plans over the phone. Okay, so that's what I'm going to talk about today. I'm going to help you guys navigate that. If you're a new agent, you're interested in selling Medicare plans over the phone, here's what to look out for, and here's some tips and kind of some truths about it breaking out into that space as an independent agent. Okay, so first and foremost, people have been selling Medicare supplement plans over the phone for years and years. Okay, that's nothing new. Even before most carriers had really great electronic online applications or complete over the phone applications, agents were selling Medicare supplement plans, just mailing them the paper applications if need be. So that's been going on for quite a long time. What is relatively new is for an independent insurance agent to be able to take enrollments over the phone for Medicare Advantage, okay? Because in years past, that was mostly reserved for agents or agencies who got what we call call center status. I never had that status, so I'm not going to go into the details of that, but more or less with most carriers in most situations, if you were selling Medicare Advantage, you were not doing it exclusively over the phone. But because of some socio-political changes, whether that was due to largely due to COVID, these carriers have had to kind of loosen up their restrictions around selling or taking enrollments over the phone. And in fact, they now kind of nurture that. A lot of the new technological advances on their enrollment platforms are to accommodate independent agents selling Medicare Advantage plans over the phone. So that was a long roundabout way of saying, yes, you can sell Medicare Advantage plans as well now, even exclusively over the phone. Okay, first and foremost. But here's some things to take into consideration and really think about before you jump in. I get a lot of agents reach out to us and ask us questions about, hey, look, I'm already licensed in 48 states. Now I want to get my AHIP certification, sell Medicare Advantage plans nationwide. Here's where I would tell you to pump the brakes and really think about your business plan. Let me help you kind of parse through that. Medicare Advantage plans differ greatly in different parts of the country, not even just across state lines, just from one county to the next. They can be drastically different in their premiums, their benefits, the networks, the doctors that they're able to see. The number of carriers that are available may vary greatly from one county to the next, much less from one state to the next, okay? And there are hundreds and hundreds of different plans and at least dozens, probably hundreds of different Medicare Advantage insurance carriers that you would really need to effectively give a Medicare Advantage prospect the best options available to them, okay? Whereas when you're selling Medicare supplements, you may need certain different carriers, but you're selling a standardized plan for the most part that's going to look the same if you sell it in California, Southern California, New York, upstate New York versus New York City. Well, at New York, there are some exceptions, but for the most part, a Medicare Supplement Plan G is a standardized plan. It's more of a commodity than great variations in the actual benefits of the plan. And therefore, you can effectively and uniformly sell that product across state lines in multiple different states. With Medicare Advantage, that is not even remotely true. You would need to have dozens of contracts with different carriers, and it would be next to impossible for any one independent agent to actually have a true in-depth knowledge of these managed care plans, what carriers will and won't accept them, what plans are the best in this particular county for this situation versus another. So most people that you find selling exclusively or largely Medicare Advantage over the phone are likely doing kind of somewhat of these two things. Number one, they're plugged in and working for a large nationwide call center like a GoHealth, Select Quote, or something similar. So their leads are being fed to them. They have kind of an advantage, like for instance, they're probably not having to pay for all of the state licensing fees, and they're also narrowing down on a handful of plans and carriers that tend to have a presence in multiple places across multiple states with somewhat similar benefits. Okay, they just don't have all of that memorized. Every single carrier, every single plan able to do what's best for them without plugging into a big platform like that that's kind of hand selecting these different markets and feeding the leads on inbound calls into them. Number two, what they may be doing if they're not plugged into a big call center is they're only selling one or two different carriers. And so they're somehow generating leads just from the markets where those carriers and similar plans are available in different states. And that's easier said than done. So what I recommend, now, I don't want to be too long-winded with this, is if you're a brand new agent and you truly want to be independent, in other words, you don't want your commissions to be paid to an agency and then paid to you, you want to own your own book of business, and you want to build your own book of business and your own independent agency, and you want to focus like 50% or more on Medicare Advantage plans, that instead of trying to sell nationwide, you sell regionally. So regionally can look like a lot of different things. For me, I live in the DFW, Dallas-Fort Worth area. I don't have to go more than, let's say, a 50-mile radius. Sometimes a little, let's say 75-mile radius. Occasionally I'll go that far. And the reason for that is because the population center around me, there's enough people for me to exclusively generate leads for that area. And the big advantage is I have every single plan memorized to the T in each of these surrounding counties in my surrounding area. I know these doctors, a lot of them personally, and even if I don't know them personally, before they even get the last name out of their mouth, I know how to spell it. I've heard of that doctor. I have multiple clients that like to see that doctor, this specialist, or they like to go to this hospital or this clinic. Therefore, I can truly know if one particular plan is going to accommodate that customer in terms of the doctors that they want to see, the pharmacies that they'd like to go to, and if a plan's going to cover the type of prescription drugs that they take or not. That's the only reason I'm able to do that is because I work regionally, and it didn't take too long of a time for me to become intimately familiar with all of the carriers and all of the plans in my area. So I could truly be an expert and make good recommendations for my clients. So I'm a big proponent, if you would like to do telesales, that you either do like one region, maybe even one whole state, or maybe like a little bit larger region if you're in a more sparsely populated area, but really specialize on that. There's a lot of other benefits, such as referrals are going to come easier when you centralize the area that you serve. So people know one another. After you gain 50 clients in that town, of course, your name gets around, you become trusted, maybe your postcards are in multiple homes in that area. Just again, your name's going to get around. You're going to get really solid referrals and become known in an area. But most importantly, if you're a new agent, it's really unrealistic to put the pressure on yourself to memorize hundreds of different plans and benefits and networks and names and doctors and prescriptions. And you're really not going to be able to always make the best recommendation to your clients if you're doing it that way. Okay, the second thing, moving right on, that you need to think about, and that a lot of agents don't understand, is it's unlikely that you're going to be selling a really 50-50 mix of Medicare supplements versus Medicare Advantage. Here's why. because depending where you're at in the country, a lot of times one of those is much more prevalent than the other. So, for instance, where I live, it's like 70% of people on Medicare have a Medicare Advantage plan. So that means from top to bottom, even all income ranges, all ages of people on Medicare, Medicare Advantage is very popular. It's well known. There's some long-standing carriers here with great networks and great branding. And so even if I wanted to start by recommending a Medicare supplement to everybody I met, there's kind of already like a cultural, regional tilt towards Medicare Advantage. So the complete opposite may be true from where you live and or want to focus on and work. So there may be certain places in the Midwest where Medicare Advantage is still next practically non-existent. All of the providers in that area more or less only accept original Medicare and a Medicare supplement. They haven't moved into the managed care realm. So it wouldn't be likely that you were going to sell many Medicare Advantage plans in that area. But there's more than just that. The type of lead that you're going to work is not going to be this, even if you're doing T65s, it's likely going to, the nature of that lead is going to dictate largely Medicare supplements or largely Medicare Advantage. And that's okay. You just need to recognize that it's probably not going to be this balanced 50-50, 60-40 split. You're going to be specializing a lot more in one versus the other, depending on the lead type that you're going to work and the market that you're working in, okay? That doesn't mean that you can't be licensed and able to sell both. You should be able to. But it's not real. You really have to understand that you're probably going to become, as an independent agent that's purchasing leads, breaking out in the business, focused on one or the other. Number 3, I just want to give you guys a few tips. If you're going to sell specifically Medicare Advantage, this is important, but also for Medicare supplements, you need to be partnering with an upline or an FMO that is going to provide you some technological tools to make that easier on you, okay? We don't want to be mailing out enrollment kits or Medicare supplement applications. If at all possible, we want to avoid that, right? The year is 2022. We should be able to enroll these folks completely using technology and not having to do any physical applications. So there's different products, like for what we use is called Sunfire. That can be very expensive on your own, but if you partner with an upline that provides that to you, like ours does at no cost, what Sunfire does specifically for Medicare Advantage, it lets you focus in and see a list of all the different plans and their benefits that are available in a given zip code. It also functions somewhat like a CRM because it does save some of the intake information that you do so that you can use it at a later time. And then most importantly, it allows you to enroll electronically, either via email or via text message, which is critical. So a lot of seniors will have internet on their iPhone, but they won't have traditional email. They're not very tech savvy with the email or with a computer, but they can sign via a link in their text message on their smartphone. So make sure you have that tool. We offer it, others do as well, but that's going to be critical. And then you can also focus on carriers that have done a great job of providing easy enrollment applications, both for MedSup and MedAdvantage, but MedSup's come a long way in this area. Any serious Medicare supplement carrier that you want to sell is going to have a pretty lights out good online enrollment, online application process. Medicare Advantage, some are far different than others. So one of the best ones that I've seen is United Healthcare's voice enrollment application. It's very simple. There's no like third-party agent that has to get on the phone with you. It's all done directly through their website, and you can get all the training and resources directly from that to do that, even without a third-party enrollment platform. And there's other carriers that probably have a really good process like that. But you need to find those, understand those, because it's going to make your life a lot easier. You're not going to be losing sales to somebody that doesn't have an email because you needed to be able to send a text message link or do a completely verbal voice enrollment application. So this obviously is not a comprehensive A to Z guide on Medicare telesales. But what I wanted to do is just paint the picture about some of the realities as, again, an independent agent breaking out in the Medicare space. If you can realize some of these things that I talked about here with you today, you're going to have a better game plan and a more realistic chance at success selling Medicare plans over the phone. So, hey, y'all know where to find us, MedicareMillennials.com. If you guys want to comment below, have any questions, you can reach out to us directly via our website. Thank you.